Well, Karinda Jagmohan, our reporter, has been reporting for Newzroom Afrika from KwaZulu-Natal throughout the coronavirus pandemic. She joins us live now. Karinda, good afternoon to you. Your province was the first province to report a case. What's it been like since then over the last 4 or 5 months?
Good afternoon to you. Yes, we actually did report the first COVID-19 case that was in the Midlands suburb of Hilton, where we saw patient 0, as he was known at the time. Now, since then, we have not seen the surge of cases that the Western Cape and Eastern Cape, for example, have seen. However, that seems to be changing, especially in the past few weeks. Just to give you an example, last week, the province recorded just over 64,000 coronavirus cases, and that number yesterday stood at just over 82,000. Now you can see an increase of just over 18,000 in a week, and just overnight we saw one of the biggest increases that we've seen in terms of the reported COVID-19 cases. Now when you look around as well, there are complaints from various community members of people who are not adhering to the regulations, and over the past weeks, as we've seen the KZN Premier give us the weekly media briefing, he has said that people are still not adhering when it comes to gatherings. We know that gatherings of 50 or more are not allowed, but still we're seeing funerals, parties happening across the province, and this of course is leading to those big surges, those drastic increases in numbers. Going forward as well now, we're also seeing as the economy opens and people are trying to now of course save their businesses, save their jobs as well, we're seeing more cases rise in that regard. So really a cause for concern now as we're climbing up the ladder in terms of provinces that are infected. We are the third province in the list of numbers of provinces that are affected.
And provisions for the peak, I mean, we've been told about field hospitals in other provinces. There's also 1 or 2 in KwaZulu-Natal.
Yes, indeed. In fact, I must also tell you that there is now issues at our KwaZulu-Natal hospitals in terms of the infections of healthcare workers. Now, we get weekly updates from the KZN Premier in terms of how many healthcare workers are infected. And at the update 2 weeks ago, we heard that over 2,000 healthcare workers were infected. He did not brief the media at the past Sunday as expected, but we do understand that number could be increasing as we're hearing from healthcare workers on the ground, from union members, about infections at our hospitals. And this is a cause for concern. Now, also as well, there is questions regarding whether or not we have enough bed capacity as we're seeing the surge in cases. Just to tell you that as far as we know, there are just over 16,000 beds that are facilitated for COVID-19 patients, isolation, quarantine, ICU. That's across our province. We also need to get an update with regards to the number of ventilators that we have. Just about 2 weeks ago, the KZN Health MEC said we have just over 200 ventilators, and more have been ordered from abroad as well as from within the country. But now we need to understand how fast that process will take place, because we are seeing, of course, many people being admitted to hospital for breathing issues because of the symptoms that comes up with COVID-19.
And then just looking ahead to the peak, I mean, what preparations are now being made? We know the Premier has been talking about this. He's been trying to prepare people. We know, of course, that lockdown regulations are still in effect, but I presume there are other preparations that are being put into place as well.
Absolutely. I'm just having a bit of trouble hearing you, but just to speak about the various regulations in place, it's not just with regards to the COVID-19 aspect. As the economy opens up, we need to have more law enforcement come to the fore to ensure that we do not have illegal gatherings. I mean, just over the weekend, we saw several, or rather dozens of beachgoers at a local Durban beach gathering, and we had to see officials from the Tikuni Metro Municipality come to that beach to disperse the crowd that had gathered there. And this is what we need to see happening, is more law enforcement coming and being more active in terms of groundwork. This is what community representatives have been telling us as we go about on stories, as well as we speak to COVID-19 patients, to people who've recovered. When we ask them about their message to people, they say that it's not just with regards to preparation from a government perspective. It's now high time for for residents rather of KZN to actually come to the fore and adhere to the regulations because of what's happening. They speak about the trauma that they go through in isolation and the pain that comes with getting infected with the virus. We spoke to a 25-year-old woman who said that she had adhered to all the regulations, and being 25, she didn't think that she would be affected in the way she was, but she was hospitalized, suffered lung damage because of what COVID-19 did to her body. It's a respiratory disease, and this, as she spoke about it, she says, it's not just a 2-week sentence and you're fine. This is something that affects you and affects your life entirely, and it could be affecting the lives of others. So while our government is preparing in terms of making sure we have enough hospitals and beds, and of course these questions we need to raise to them as we come to the next media briefing about that readiness. It's also now, as community members and those who are infected say, it's up to residents to ensure that they adhere to the regulations to save from this virus from spreading and from the surge in cases that we are seeing in KZN.